What are some key elements of successful safety culture training programs?
Well, I think that one of the key things is um, starting with when you're working with the team themselves, how do they look at the strengths of their individual members of the team? What are the weaknesses? Where are the gaps? And who is going to take responsibility for what? And doing drills to make sure that they're ready for those kinds of things, because we're only as good as the training that we've had. So if you haven't done enough training and regular so that it's sort of autopilot, you're not going to be ready. And you have to know which, it's not who's the leader that has to take responsibility. It's who is good at this aspect and which strengths are for which parts of any situation that arises, so that everyone owns the problem and supports each other in making it not be an endless downhill slope.
What you can do is also you can measure the safety culture by asking the team before you do any intervention. You ask the team several questions. They're basically, you're testing how much they believe that the organization is safe. In other words, you can ask questions like, would you bring your son or your daughter or your father to the hospital and feel safe? Or if you don't feel safe, why don't you feel safe? Because, so that you basically have a sense of what the team, that again, they know exactly what's going on, feels about the overall atmosphere. Then you do your intervention. Let's say something happened in the operating room. You do the testing before, you intervene, and 6 months later, you go back and say, by the way, now that we have done this intervention, are things changed? Do you feel like now bringing your family is safer than it was before? And basically, again, if they're engaged and they tell the truth because they feel like they're safe, you will know for sure if you were successful or not. And if you were not successful, you need to go back and do it again, because obviously you didn't try hard enough and people didn't get the information that they needed.
But even so, even if it is successful, the job is never done because there's another situation around the corner. And so that readiness and awareness that mistakes happen and need to be looked for and prevented from escalating is imperative.
And in areas like ICUs or the operating room, you actually have the team bring up every few months one topic that they feel that they need to address. They study the problem, they make the changes, and when they feel like the problem has been resolved, they go to the next one. They do again. What is the next thing that could be dangerous? They vote it up, and what comes up to the top as the most dangerous, according to the team, is being dealt again. So this is a continuous improvement.
And then you can add in others if you have looked at benchmarks in other institutions and seen things that they're not bringing up. You can make them aware these things are happening in other institutions. How ready are we for those same situations as well? Because sometimes just because something hasn't occurred doesn't mean that it can't happen.